Hey y'all, it's Dr. Samina Rahman, Gyno Girl. I'm a board-certified gynecologist, a clinical assistant professor of OBGYN at Northwestern Feinberg School of Medicine, and owner of a private practice for almost a decade that specializes in menopause and sexual medicine. I'm a South Asian American Muslim woman who is here to empower, educate, and help you advocate for health issues that have been stigmatized, shamed, and perhaps even prevented you from living your best life. I'm better than your best girlfriend and more open than most of your doctors. I'm here to educate so you can advocate. Welcome to Gyno Girl Presents Sex, Drugs, and Hormones. Let's go. Hey y'all, it's me, Dr. Samina Rahman, Gyno Girl. Welcome to another episode of Gyno Girl Presents Sex, Drugs, and Hormones. I'm Dr. Samina Rahman, Gyno Girl on Instagram. I'm excited to talk to you guys about an organization that I'm a part of today. But first, I want to remind you that I'm a sex med gynecologist and a menopause specialist here in downtown Chicago. I have my own private practice. And I also am heavily involved in many organizations such as the International Society for the Study of Women's Sexual Health, ISWISH. I'm on the board of ISWISH, and I'm also part of ISSM, as well as the Menopause Society, and I'm a certified doc with them. Today, I'm talking to two amazing women from the organization called HEART. It is a nonprofit organization that works to promote sexual health, uproot gendered violence, and advance reproductive justice for those most impacted in the Muslim community. As you know, I am a Muslim, and I've discussed this in the past. It was founded in the South Side of Chicago 15 years ago, and HEART has grown into a national movement empowering Muslims with vital information, advocacy, and resources. I'm speaking to Nadiah Mohajir. She's a lifelong Chicago and a Pakistani American Muslim, mother of three, public health professional, reproductive justice activist, and anti-sexual assault advocate. She's the co-founder and executive director for HEART Women and Girls. For over a decade, she has led this organization to provide reproductive justice, sexual health education, and gender-based violence awareness programming and advocacy to thousands of individuals, organizations, and campuses across the country. HEART ultimately aims to dismantle the stigma, silence, and systems that prevent individuals from seeking information, healing, and justice. She has worked in public health and reproductive justice for over 20 years in a variety of settings, and she earned her master's degree in public health in 2009 from the University of Illinois at Chicago and her bachelor's degree in public policy from the University of Chicago. Nadiah is also a participant in a number of fellowships, including the American Muslim Civic Leadership Institute, Germanicos Fellowship, and so much more you'll see in the bio here. And she's a co-author of The Sex Talk, a Muslim's Guide to Healthy Sexual Relationships. I'm also speaking to Sahar Pirzada. She is the director of movement building for HEART. She's a Pakistani American Muslim woman from the Bay Area who lives in Los Angeles right now. She's dedicated to serving the Muslim community and draws from her extensive experience working as an organizer and an educator within community spaces. After graduating from UC Berkeley with a degree in development studies, Sahar moved to Singapore, where she worked on a project coordinator for the UN-funded regional project on promoting gender equitable interpretations of Islam and for the full adaptation of SIDA. She passionately believes Islam is a religion that is sex positive and promotes healthy sexual relationships. And she has been with HEART for the last decade. So you guys are going to enjoy this, learning about this community organization, this national nonprofit, and hopefully you'll learn a thing or two as well. So let's get at it. Dr. Samina Rahman, Gyno Girl, here for another amazing episode of Gyno Girl Presents Sex, Drugs, and Hormones. Today I have a great treat for you guys. We are speaking to two amazing community leaders that are known nationally for the work that they're doing in sexual health and reproductive justice from the community organization HEART. That is an organization that promotes sexual health and gender violence, as well as advancing reproductive justice within the Muslim community. So I've talked about the fact that I'm Muslim many times on this podcast. So I'm excited to have the voices of both Nadiah and Sahar, and we're going to talk about what brought them into this community organization, how they grew up, and, some of the new initiatives coming forward. So let's just get started. Thanks, guys, for being on the podcast today. Thank you for showing up and talking to us today.
Thank you for having us.
Yes. So I mean, maybe I'll start with you, Nadiah, since you're kind of like the OG when it comes to a lot of this. Because I met Nadiah, I want to say like maybe 8 years ago or something.
A long time
Like
ago. Yeah.
almost. I think I had just so I'm 10 years into my practice. I think I was like a year or two into starting my practice. And I'd heard about your organization from someone else in the community, and I thought it was a good intersection of what I was already dealing with my Muslim patients that had a lot of sexual dysfunction. So I found out about you guys who are creating so much awareness about sexual health issues and gendered violence and other things, like a whole slew of things actually. But Nadiah, tell us a little bit about like how you were brought up and then how that eventually led you into this line of work.
Thanks so much, Dr. Rahman. Once again, I want to thank you for having Sahar and I today. It's an honor. We love your podcast. So my name is Nadiah Mohajir. I'm founder and executive director of Heart. And as you mentioned, it is a national nonprofit that is working to advance reproductive justice and prevent gender-based violence in Muslim communities. And how did I come into this work? I mean, part of it is my own lived experience and my understanding of the social and religious context in faith communities that sort of intersects with folks sort of taking control or not taking control of their reproductive health and violence decisions. And then part of it was by accident because of the work that I was already doing in some of the spaces that I was already in. But in terms of my own lived experience, I was raised in a very traditional, culturally traditional and moderately religious South Asian Pakistani family. And a lot of the conversation, was there, it was a little stigmatized, but my mom was proactive enough to, want me to still be exposed to accurate information. So, I was the one Muslim kid. I grew up in Chicago in the suburbs, and I was the one Muslim kid that was allowed to go to sex education because my mom thought it was important, and she did the best that she could. I remember her going to the field trip and then coming back home and her cooking dinner at the stove and being like, "So what did you learn today? Anything new?" And me just saying nothing I didn't already know. And then that was like the end of our conversation. But she sent me, and she did not, she let me not only go to those field trips and learn about all of that through school, but, she was the mom who also let me order the teen magazines that also, gave sex education that way and things like that. So I actually informally found myself playing that role for my friends who didn't have access to that information. And so, like,
Did your parents come from Pakistan, or did your grandparents come?
no, my parents came from Pakistan.
Okay, so that's really progressive, actually, for like,
Yeah.
because
Yeah.
I'm adopted immigrants too, and it wasn't.
Yeah. But I remember like sitting at like family parties and we're holed up in one of the girls' rooms, and then me playing the role of sex educator and them asking questions about, well, what about this and what about this, and me kind of sharing, well, this is what I read in this magazine, or this is what my teacher said about this. And so that's sort of how I fell into that role, informally as a sex educator, and then as we got older, serving as a resource for folks who were navigating relationships and abuse and violence, and coming to me and saying, one, we need someone to believe us and someone to hold space with us, but then more importantly, we need someone who can actually help. So do you know who can help us? Can you show us what we need to know in order to get to safety? And so I think that's how like I ended up here. And I'm gonna let Sahar share her story too.
Yes. Sahar. Welcome, Sahar. Thanks for being with us. Tell us everyone about you as much as you want to reveal.
Yeah, absolutely. So my name is Sahar. I use she, her pronouns. I'm the director of movement building at Heart. I've been with the org for about a decade now. So I've
How long has the heart been around? Give the
almost 15 years.
15.
Yeah. Yeah. So, 2/3 of the lifespan of the org.
Yeah.
But my introduction to this world and to this work was actually when I was living in Singapore,
Oh.
and I was fresh graduate. I had graduated in 2012, gotten married, and moved to Singapore with my husband, who was doing his master's out there. So he was doing his master's, and I was working at a nonprofit in Singapore that was working on like gender equity, and I was the like programs associate. And part of my role as the programs associate was to run sex ed workshops for private schools in Singapore. So, Singapore had like an abstinence only until marriage curriculum, which is basically nothing. And so a lot of the private schools there would hire our organization to come in and offer like comprehensive sex ed. And so the ways that I actually learned about sex ed as a Muslim was through creating curriculum to then teach these students. And so I would have to like do like condom demonstrations and like teach about like, like consent and all these incredible things. And I basically got to curate like what I felt would be a helpful and effective curriculum for, and these are like, I think, maybe seventh and eighth graders, like they were on the younger side. But it was great. So I had a lot of like colleagues that I worked with who exposed me to a lot of really incredible information. But one of the things that I felt was kind of missing from this curriculum was the faith aspect, was to really talk about how does faith inform our decision making or our ideas or influence our understandings of sex. And so I think that I also grew up in like a Pakistani household in the Bay Area in California. And it's not like there was a stigma or any kind of like discomfort with talking about sex. It just wasn't something that like came up at the dinner table, you know? So, like my family wasn't like, oh, we have to censor out like scenes whenever we're watching movies or television. Or, they were not like that. They were like, whatever, like this is part of life. So just deal with it. Like we could watch the kiss scenes in the Disney movies. And I think us ourselves were a little awkward. Like we were awkward as kids. Yeah, but it wasn't like a big deal. Right. And they didn't make it a big deal. And then I went to Islamic school, and I remember like, I think it was like in seventh grade, they separated the classroom. So it was like the guys went with one teacher, the girls went with the other teacher. And they did do a sex ed class for us. And I think, and it wasn't like it wasn't like something that they were trying to make a hushed conversation, but they didn't also give a lot of information. It was very like biology based, like you have sex to reproduce type of thing.
Right.
So not in the context of like healthy relationships and consent and all of that. And the only thing I remember is that in my Islamic school, the science teacher was like, and you have to do ghusl after you have sex.
Yeah, for those of you who don't know what ghusl is, an ablution, like it's washing afterwards that we do.
Yeah, it's like a ritual. It's like a ritual like bath or shower. And so which I was like, okay, cool. Up until that point, I hadn't seen faith be an explicit conversation in conversations about sex and healthy relationships and like even like reproductive health.
Yeah.
Until I was reached out to on Twitter by Nadiah. And so Nadiah and I participated in some Twitter town hall about Muslim sex ed. And she reached out to me on Twitter and was like, I'd really love to connect with you. I liked what you were saying on Twitter. And so at that time, there was no Zoom. And so we Skyped while I was in Singapore and she was in Chicago.
Yeah.
We had like a Skype session and I was like, all right, this is great. I love what Heart is doing. And so, I started to kind of volunteer from Singapore. And when I got back to California in 2015, that's when I kind of hit the ground running to join as like a volunteer trainer and then eventually staff. And the rest is history.
Oh, that's awesome. I love that. Oh, wow. See how social media brings people together sometimes. So, because you wouldn't have known each other otherwise.
Yeah.
That's interesting because I think both of you guys grew up in sort of big cities and more like urban ish area. Like I grew up in North Carolina and was not the case where that was, I always talk about like sex ed wasn't happening and then I wasn't allowed to be involved in the discussion anyway. So Har, were your parents were from Pakistan or your grandparents just came from Pakistan?
Both my parents were born in Pakistan, but my mom moved when she was like 10 to Southern California. So she actually grew up in the area that I live now and like, did a lot of her schooling in Southern California. So I consider myself like basically second gen, based on how I was raised.
Sure, that makes sense. And then how did the Heart actually evolve into like help? Because I mean, obviously, gender-based violence, common in so many different cultures and arenas, across the world. Was there, and I think we spoke about this at one point, but was there an incident that you said, okay, I have to do this like on a nonprofit level, like, or was it just multiple people coming to you and saying like, I need help in this relationship, trying to get out of this relationship, or what kind of services do you think you could help me with?
Nadiah, I feel like that's all you, the origin story.
Yeah, I mean, I think it was, I'd have to say it was a bunch. So, part of the work that we had started here in Chicago, it was, I was actually a consultant at the Office of Women's Health at the Department of Health and Human Services. And we had started that work through them because they wanted me to lead programming that was reaching Muslim women and girls. And what we learned from that very quickly was the more spaces that we created for women and girls to come together and talk about their bodies, talk about puberty, talk about relationships, with safety, of course, in mind, first and foremost, the more disclosures we started getting, right? Like the more, and I'm not just saying disclosures in your traditional sense of like I was assaulted, but also disclosures around I'm having painful sex or I had unprotected sex and I don't know where to go to get STI testing or I'm in an unhealthy relationship and my boyfriend is, pressuring me to have sex, but if I leave this relationship, they're going to expose me to my family and I don't know what to do at this point. Maybe I should just marry him, right? Like so like we were getting disclosures of all different sorts of really common and complex reproductive health and violence experiences. And we found ourselves playing the role of health educator and advocate with each of them on an individual level. And then I think where our visibility rose was in 2014, there was a case that was sort of went public in Chicago of sexual abuse that was perpetrated by a very prominent and well-known imam in the community. And that sort of elevated the conversation to a national level because of the scope of the abuse that was discovered. And so that's how I think, from, as Sahar mentioned, we're 15 years old. So like 2010 to 2015, we were doing all of this work, on a grassroots level, on a one-on-one, let me reach out to you kind of level and just doing the best that we could. And then this case, because we supported the victims of this case, and the case became very public. It was, in the New York Times, the imam got arrested, all of the things, it raised our visibility to a national level. And then we started getting requests to do trainings and workshops across the country. By then, Sahar had moved to LA. So she was doing similar work locally in LA, where she was on campuses in particular, where she was also navigating different disclosures, things that would happen in student organizations or things that might happen between students and faculty and things like that. And so it just kind of ended up being something that we could show patterns around and tell stories around to actually apply for funding to build these programs out.
Sahar, tell me a little bit about how you think the communities have responded to Heart, like, just your existence, our existence as an organization since I'm on board. How has the community, like in LA, Chicago, I mean, what do you think in terms of response by both Muslim community and community at large?
So it's been very interesting because I think in maybe our earlier days, we were kind of building the plane while we were flying it and like responding to things as they came in. But as we kind of settled into our org and started to think about, well, who is it that we're actually trying to center in our work, right? Who is the most impacted when it comes to gendered violence in our communities or reproductive justice, right? And it became clear that we need to be explicit about the fact that queer, trans, non-binary Muslims, folks who are systems impacted by like racial injustice and surveillance, folks who are also in, dealing with multiple systems of oppression against them are also the most vulnerable and less supported when it comes to issues of gendered violence and when it comes to issues of reproductive justice, right? So as we became clear about who we were serving, it was really interesting because I think less folks in the Muslim community who are maybe more privileged, more resourced, have more access to maybe Muslim community. They have more access to Muslim community. They felt less comfortable with our presence. They felt less comfortable with our existence because we actually challenged the privilege that they had in a lot of ways, right? We were asking them to make space for more, to center somebody different, to include things that are not seen, quote unquote, as Islamic always, as part of their conversations in the masjid setting. And so, it over time, I think we got less and less invited to the MSAs and to the masjids and to the youth groups.
Yeah.
But we started to grow alternative community in those same places, right? So like the third spaces instead of the masjid, or the instead of it being invited to an MSA, it would be like a gender club that had Muslims in their leadership, right? So and so that became really interesting and really exciting for us, knowing that folks want this. And it's actually folks who being Muslim is a really important part of their identity, and they want to connect with that side of their identity, but they're actually not finding the opportunities to do so in traditional Muslim spaces. And so building community with folks who are already marginalized in a lot of ways became part of our branding and became part of a part of the work, is like making spaces that center survivors, right? Became part of our work in and of itself. And so we've had haters. We've had people literally attack us through their, whatever blogs they have or YouTube channels that they have. Folks who have canceled contracts with us after learning that we're like LGBTQ affirming. Folks who have like taken meetings with us and then on the meeting said, actually, we can't support you because we just realized like you support abortion access. Like, it's also just stuff where it's like, okay, we're not going to compromise necessarily on our values. We've been very clear and very transparent about who we are, what we do, who we serve.
Yeah.
And it also feels like a huge disservice to who else we could be reaching because of gatekeepers in the Muslim community who are uncomfortable with that truth.
I think that's what makes Heart unique from, what I've seen. In this field of sexual medicine, I see a lot of different organizations that are, trying to be a little more like sex positive or sex educating, but at the same time, don't consider like sexuality in the equation. And so will still, I guess, exclude that population or still talk about it in the form of, even when it comes to, healthcare rights and abortion access, will still exclude that conversation. And so I think that's what makes Heart very unique in that capacity, that it is, really trying to be all inclusive in terms of, however you identify yourself, but your your main center is Islam, and that's what you are sort of believing and fighting for. That I think that makes it very unique. And so I applaud you guys because I know that how many haters probably come toward you. But let's talk actually about some of the programming, some of the program that you've done, some of the book that's you guys have put out, and then the newest program that you're launching. So tell us about some of the stuff that you've done, some of the sort of platforms or like what exists already. And I also want to, say a bit about the book that you wrote 2 years ago, maybe 2 years ago. Yeah.
So one of the things that you'll learn about us is we love acronyms at Heart. So even Heart itself is an acronym, and it is an acronym for our 4 programming arms. So health education, advocacy, research, and training. So it's exactly what you think it is. Health education is our, in-person virtual workshops, very interactive workshops for people to learn about their bodies, to learn about violence, to learn about consent, and apply it to their own lives. In part of our health education arm is also developing written materials. So we have a very large resource library that people can go to, and they can find fact sheets, they can find toolkits, they can find videos. And one of our most recent offerings that we're very proud of is our book that we published called The Sex Talk, A Muslim's Guide to Healthy Sex and Relationships. It's available on Amazon. Thank you, Sahar. And it's also available through Barnes & Noble as an ebook. And so that book is our labor of love. It's part textbook, part workbook, and part journal. And so it gives folks a foundation of what they need to know when it comes to biology, contraception, STIs, how things work in your body. But then it moves beyond that, and it talks also about, okay, now that you know all this information that you learn in sex ed every, 5th grade, 10th grade, whatever, how do you actually apply it? What are the mechanics of sex? What happens when it doesn't go the way that you planned? What happens if there's pain? What happens if there's no consent? What does it look like to not have consent? Right. And so the book goes into a deeper conversation around the mechanics of sex, the logistics of sex, what is consent and what is not. And then it also goes into keeping up with your sexual health. So like, what do you need to know when you're going for your first pap smear, when you're going for fertility treatments, when you're pregnant, right? And then also goes into the longest chapter is the last chapter, which is on healthy relationships. And the healthy relationships chapter is grounded in Islamic values for what we've done a lot of research on what we believe makes a fulfilling and thriving sexual or otherwise relationship in Islam. And we've basically created an acronym that is, it's called the Rida framework. Rida is the Arabic word for fullness of choice. And it basically acknowledges that we need people in order for somebody to, feel fulfilled in their relationship, they need to be in fullness of choice. And fullness of choice when they're deciding to have sex, fullness of choice when they're deciding not to have sex, fullness of choice when they're deciding to get married, when they're deciding to, start dating, not date, etc. Right? And so the Rida framework is grounded in different Islamic values. So R is essentially rahma, which is compassion. I is ilm, which is knowledge, and like emphasizing what it means to be informed and what it means to have healthy communication with your partner. The D is adala, which is inviting people to think about a fair and equitable relationship. H is housed in safety and security, which is also horma. And what does it mean to be safe in your relationship, physically, emotionally, spiritually? And then A is affirmed in commitment, which is aqd in Arabic. And so what does it mean to be in a relationship that is commitment? However you define commitment, we recognize that committed relationships in Muslim communities also looks, very diverse. So thinking about what does it mean to define commitment and what does it mean to define fidelity, right? And then we bring up some of the more complicated things, nuances in our faith around, marriage and divorce law and polygamy and like some of these other issues that are in our faith that we did not want to ignore, but also wanted to sort of uplift the conversation around just because you can doesn't mean you should. And really think about what are the implications. Like you can probably find a loophole for whatever it is that you want to do. And what are the implications? Is it ethical? Who is it harming? Who is it not harming? And so that's really the crux of our book. And yeah, a lot of folks are sharing that they found it really useful in of all ages, really. Like young people have shared that, but even women who've been married for 25 years said that they, improve their own relationships with their partners and things like that. And it's really challenging. The last thing I'll say about the book is that it's really challenging Western feminism and Western sex positivity to say like, oh, I can, it's my body. I can do what I want, whenever I want, whoever I want. Nobody says anything. And it's challenging that to say that's not working for us. But it's also challenging the phenomenon that Sahar shared about, what happens in Muslim communities and mosques where they focus the conversation only from an abstinence lens and only on hygiene, right? And they don't talk about all of the other things. And we're saying that's not working for us either. So we're going to do something different, and we're going to pull from our faith values, but also pull from, best practices in public health education and say, this is what you really deserve as a community when it comes to conversations around sex. So that's the book.
Yep, it's a wonderful book. It's like she said, it's available on Amazon as well as in Barnes and Noble. And then maybe Sahar can tell us a little bit about what we're launching in 2 weeks.
Yeah, I mean, so for all of you in Chicago, you'll get a treat in the sense that October 14th, all of the billboards for this latest campaign are going to pop up in multiple locations in Chicago. So it's for our latest campaign, which is called RAHM, and it's another acronym. It stands for Reproductive Agency Honoring Impacted Muslims. And it's it's been my baby for the past 3 years, and it is something that we're so excited to share with the community at large. But it's really about an offering to the Muslim community, uplifting that reproductive justice is inherently part of our faith. And we've developed a beautiful microsite where we have a reproductive justice framework that we've been building out for years, where we were in conversation with Muslim scholars and doctors and doulas and impacted community members. And we had all these interviews, and we said, wow, there's so much that we can look to in our faith that guides us around decision making for sexual and reproductive wellness. And yet we're not talking about that, right? And so how do we uplift that so that Muslims in the United States especially can recognize that there's almost like a legacy of Muslims taking care of their bodies and of our faith affirming our right to take care of our bodies, and also of resistance to oppression when those rights are not offered to us. And so the microsite itself, it has a timeline people can engage with around that legacy and that history. It has the framework. It has a set of values that we've developed. And it has a bunch of resources as well. So a lot of the conversations we had with even Dr. Rahman, we developed one-pagers and resources for our community around sexual and reproductive wellness for Muslims. And so we're really excited for folks to access those resources.
Yeah, it's going to be great. And I think, these resources, the education is so critical, for all of your, all that you're doing. The sexual health stuff is, that's one of the biggest things. I mean, as a group, we've done research, and we can talk about that briefly as well, in terms of, the experiences of Muslims in North America. And, I think education is always one of the things that, we think could prevent some of the sexual dysfunction, or, sexual gendered violence. Just knowing what resources are available, what's normal and not normal when it comes to your own sexual health. And so everything that you guys are doing is just wonderful. So I'm so excited that this new campaign is finally getting launched. I didn't realize it was been 3 years in the making, though. I guess that makes sense.
Yeah, we started, so like for context, this was also a project that emerged because we were launching our reproductive justice fund, and we
Right.
knew that Roe v. Wade was going to be overturned, and we wanted to have a resource for Muslims to access so that they can have support if they're denied care, right? And so, but then we were thinking, and we started talking to all these doctors and scholars. And, when we were building out the reproductive justice fund, we also realized there's a gap in knowledge of people being able to access the fund before they feel like they can access the fund or want to access the fund. Them realizing that actually taking care of my health in general, taking care of my body in general, is very much part of me being Muslim, right? Like God has entrusted me. So we say, God has entrusted us with these bodies. And it's actually like part of our responsibility as Muslims to take care of these bodies, and making decisions about our sexual and reproductive wellness is part of that equation. You can't do that though if you don't have access to the information, the systems, and the resources that you need, right? So you could have the law, you could have the hospital, but if you don't have also the kind of spiritual guidance, for example, that's going to tell you like, oh, actually me going and like getting the HPV vaccine is supported by my faith, right?
Yes.
Like, then are we really also breaking down all the barriers and ensuring that Muslims have what they need to make those decisions in empowered ways? So that's kind of the gap that we're trying to address with some of this work, is the faith equation being front and center.
I think the only thing I would add to that, if that's okay, is another sort of theme that this Raham campaign is exploring and inviting communities to think about is, what does it mean to put the agency of decision making back in the hands of the directly impacted person, rather than, of course, the state, right? But also the kinds of policing and judgment that happen in our communities and in our families. So if to Sahar's example of the HPV vaccine, if I'm thinking about getting my children, my daughters, vaccinated with the HPV vaccine, and then there's an auntie in the masjid saying, oh, now your kid is going to go become promiscuous and have sex, right? You're giving them a permission slip. Like, that is judgment and policing that actually that has been, like, the agency has been taken away from me by this judgment being passed. And if I actually cave to that and say, well, maybe my children shouldn't have that, or maybe I shouldn't have this for myself, or I'm doing something wrong or haram, right? By doing this, now all of a sudden the agency has been taken out of my hands. And so it's just about, like, really thinking about, what does it mean to build a community that is grounded in rahma, in or compassion, in judgment-free support, in community care, rather than, but really, do you really think you should do this? Really, right? Because women are, I mean, I know that people of all genders make decisions, but we also live in a community where women are taught to doubt themselves already. And now we're in a community where you're getting all of these messages like, no, but this is haram. No, but you shouldn't do that. No, but what are they? Right. And like, instead, we should trust directly impacted people to make their decisions about their body in consultation with, their medical providers, their partners, etc. But really drowning out the other noise that is just so common in our communities, and as a result is a barrier to care.
I mean, I think we've all been in those scenarios. Like, I can remember being at the masjid so many times when, I've been told one thing or another, don't do this, don't do that. Oh, your hair's, showing too much, whatever the case may be. And, it's like, because people who, you feel so strongly about your religion and you want to practice it, but there's so many judgments being placed on you, then it can really inhibit, like, you're right, your own autonomy, your own decision making about your own health, right? At the end of the day, like, okay, what if I don't vaccinate my daughter? And then when she's 25 and has her, whatever experience, she gets cervical cancer because I chose to listen to some auntie that said, this is going to make her, like, even, sexually promiscuous, or, whatever the case they thought that she was going to do. And then in that way, I'm actually hurting my own, family member by not doing it. So I think all of this is so true. And I think any of us that have lived in a community of any religious basis, you'll probably see this where, like, I mean, we live our own, we know our own lived experience, but I hear it from my friends who are Catholic and Jewish and all the other religions when they come to these communities, that the judgment is always there. And that's the one thing I love when I met you guys. I was like, oh man, they're just not, because I was so used to growing up with judgmental Muslims. And I was like, wow, these guys are not judgy at all. This is awesome. Because I feel like that makes it so like welcoming overall. And I think that's obviously one of the goals of part, which is one. Let's briefly just talk before we talk about how people can reach you guys and how to, contribute to your efforts. The research that was done a few years ago that I was involved with. Do you guys want to talk about, because this was, I think, from what I can see, the first, national survey, or actually throughout the North American continent, that was done. So do you guys want to talk about the research that we've done and presented?
So we did research in 2020. We launched in partnership with the Center for Urban Research and Learning at Loyola University. And you, Dr. Rahman, you were one of the principal investigators. We launched a national study to look at the prevalence of sexual violence, sexual dysfunction, and spiritual abuse among Muslims ages 18 to 45 in the United States and Canada. We got about 830 respondents. And by the end of the survey, about nearly 600 is what are people who were eligible and completed the survey. So the tool that we used was with the CDC's National Intimate Partner and Sexual Violence Survey, NISVIS. So we wanted to use a tool that was validated and that, had been used in other communities. And we wanted to use a tool that, when we found findings and data, we could see what the CDC found. And of course, I want to name that CDC.
The FSFI for the sexual dysfunction.
Yes, the FSFI for sexual dysfunction. And, of course, the sample sizes for all of these validated instruments are dramatically different than what we had, right? CDC had millions and millions of participants. The FSFI also has tested so many different survey participants. So it's not completely comparable, but it still gave us an idea of what we found. And what we found was pretty compelling statistics. One of our findings was overall, we did find a pretty high percentage of respondents reporting having experienced sexual assault, some form of sexual violence, contact sexual violence in their lifetime. And so we had, for example, 97% of our respondents overall experienced some form of sexual violence. So that includes sexual harassment, sexual assault, and sexual abuse. All of these were also defined so that folks knew what they were talking about. Of those 97, of that, when we went a little bit more deeper, 93.9% of respondents reported experiencing some form of sexual harassment. 53.6% experienced stalking. 58.4% reported experiencing some form of attempted or sexual or completed sexual assault, and 28.4% of respondents reported experiencing some form of intimate partner violence. And that's just the sexual violence data. We also looked at spiritual abuse and sexual dysfunction. And in sexual dysfunction, we found about, I think it was like 45% of our population reporting that they had experienced some form of sexual pain on a regular basis with intercourse. And of that 45%, 66% shared that they had not seen a healthcare provider for that pain. And when they were asked why, the reasons, differed from I didn't know that I could, like I didn't know this was not normal, to I was ashamed, I was embarrassed, I didn't have insurance, I didn't know where to go, right? And so both of these data sets, whether we're talking about violence or we're talking about sexual dysfunction, are really indicative of the fact, that one, these are common issues in our communities that we can no longer ignore. They're not specific to Muslim communities. And we know this from other research that, other communities, whether we're talking about faith communities or cultural communities, are experiencing similar levels of sexual violence and sexual dysfunction. So we're not unique in that sort of way. But it is a wake-up call for our communities to, really face these issues openly and honestly, and say what interventions can we design to mitigate some of these numbers and bring them down.
So total wake up call, like you said. That's why Heart is such an amazing organization, because, just proving the reason that it needs to exist is right there, like right in the research there. So Sahar, why don't you close by telling all the listeners what they can do? Like, now you've inspired all these people to like want to help or maybe reach out because they don't even know, like, oh my God, that's me. That's me they're talking about. Like, where can they, and this will be in the show notes too. But, tell our listeners, like, where can we find Heart? How can we get involved, and how can we contribute? Even if it's, volunteer hours, if it's monetary, whatever, this is a nonprofit organization, so it's tax deductible. Tell our listeners what they need to hear.
Yes, thank you for that. Thank you for this opportunity. We'd love to invite your listeners to follow us on social media at Heart to Grow. We have a very active Instagram. Please do visit our website. We have the main Heart website, which is hearttogrow.org, as well as the microsite specifically for this campaign, which is rahim, rahim.hearttogrow.org. And please donate generously to our Reproductive Justice Fund. That is the fund that we are going to be piloting actually this coming January with 4 agencies that have networks of birth workers and doulas serving Muslim clients all over the United States. And so making sure that they have access to sexual and reproductive health care when they need it and as they need it. If you are somebody who also is a healthcare or working professional, we'd love to get to know you and have you join our referral network. We have a sexual and reproductive health referral network. And so, please reach out to us. We'd love to connect with you and your agency. So that, we could build with you. And then if you're also a student, or you have any sort of community and you'd like for us to come and do a workshop or spread education about the work we do, we'd love to do that as well. So please reach out. We're also very responsive on social media and via email.
Yes, and generously donate, because they are a nonprofit that depends on, donations from everyone to make sure that they can continue to do the work to help people all over the U.S. here. So thank you guys. Thanks, Nadiah. Thank you, Sahar, for joining me today on Gyno Girl Presents Sex, Drugs, and Hormones. I'm so excited about this new campaign and really so proud of all the work that you've done for the community. It's amazing. Remember, I'm here to educate so you can advocate for yourself. Thank you for joining me on this podcast, Gyno Girl Presents Sex, Drugs, and Hormones. If you have a second, please subscribe to this podcast. I'd love for you to be a follower and learn as much as you can about the things that we're going to talk about with all the people on our journey. Please review us on Apple or Spotify or wherever you listen to podcasts. These reviews really help. Review us, comment, tell me what else you want to hear. To get more information, my practice website is www.cgcchicago.com. My website, for Gyno Girl is www.gynogirltv.com. My Instagram is Gyno Girl, so please follow me for some good content. Additionally, I have a YouTube channel, Gyno Girl TV, where I love to talk about all these things on YouTube. And please subscribe to my newsletter, Gyno Girl News, which will be available on my website. I will see you next time.